its Masala followers. I'm in Bradford today with one of its very famous citizens, Dr. Naresh Sharma, who is a dentist by profession but has made a huge contribution beyond his professional duty in many different directions, including the field of charity, the field of education, and really also doing a lot for his motherland in India. There are dentists in the Indian community all over the country, and they provide excellent service as dentists because of their high professional ethics, and they are very popular with their patients. Dr. Sharma, can you tell us a little bit about the work of the dentist and in a way the values that dentists create? What is distinctive about Indian dentists?
Well, traditionally Indians have been mainly going into medicine. They want to be doctors. But I probably was one of the first Indian dentists in this country, one of the first ones. Since then I've had hundreds of followers who have gone into dentistry. Mainly because it's a profession that's a caring profession, firstly. Secondly, most people go into general practice and they own the practice, it's a business, so they can run the business, they're independent, and it gives them a good living. And they're actually working with their hands, treating patients, getting rid of pain, and giving people nice smiles, so you get a lot of joy out of that. And there's more and more Indians have gone into dentistry in the last 20 years. In fact, some dental schools the majority are Indians in this country, or of Indian origin.
And what makes them so popular with their patients?
Well, I think we all have this cultural heritage of India, where we're basically a caring community. We take pride in what we do, and we run a business as well. Most of the practices that as someone who's involved in education, like you say, I'm involved with the Royal College of Surgeons, where we run various diploma courses. And these courses, some of these courses involve actually visiting practices. So in all the years that I've been involved with it, I've probably visited over 300 practices in this country. Some of them are Indian-owned practices, and you can see the pride with which they run the business, the way they run the practice to a very high standard. And this is something that's noticeable. I'm not saying that non-Indians don't, but being of an Indian origin, that sort of, I take more notice of that than anything else.
What you have done also is you've taken some of your knowledge and experience from this country back to India, and especially to the remote and poor villages of India. Can you tell us a little bit about the work that you do there?
Yes, yeah. I got involved with this project in 1998, where the founder of the charity in India, Deen Dayal Research Institute, a chap called Nanaji Deshmukh, is very well known in India, because he used to be a minister in the government there, and he gave up his role as a politician and set up a charity saying the politicians will never bring the poor people of India up to a good standard. Politicians are for themselves, not for the people, is what he used to say. So he started a self-help scheme in India where the people have to, is through self-reliance basically. So the self-reliance scheme in the villages, where you give them the tools to do the work rather than hand out food, give them the knowledge, the know-how, the micro-economy, the micro-banking, where you give them small loans to start a business, agriculture, give them proper seeds to grow food, give them water, give them education, give them health. And Nanaji Deshmukh came here to the UK and asked me to get involved with the health side. And I said to him, well, I'll come and have a look. And Nanaji was a friend of my late father's. So I went to India to have a look, and it's a place called Chitrakoot, which is one of the poorest part of India. The average income of a farmer there is less than $1 a day. And for that, they have to support a whole family, work 10 hours a day. So I went to Chitrakoot, had a look, and they had this beautiful site of the hospital, which has been funded by Tatas. Tatas funded the infrastructure. And there was, as a dentist, I was looking at the oral health care of the population. and there wasn't a dentist within 2-3 hours driving. So I said to Nanaji, okay, I'll go back to the UK and I'll see what I can do. So I came back here, talked to various organisations in the UK. We raised over £200,000 and I set up a dental facility within the hospital called Rogadam, which houses 3 surgeries, and we employ local dentists, and we treat over 30,000 patients a year in this hospital. And since then we've set up a mobile clinic, a 4-wheel drive that goes on from one village to the other 300 days out of every year and provides a free service. And it's gone beyond my imagination in the last 10 years. It's progressed so much. And more recently we set up a facility to do cleft surgery, patients with cleft lips and palates. And for that we applied to Virgin Atlantic, the airline, for funding. And they have this scheme called Change for Children, and where people who travel on the plane leave any small change into an envelope. And over 3 months they collected over £80,000 for our charity, the Educator. And we used that money to treat these patients with clefts. And I got some of the top plastic surgeons in the UK and some anesthetists, maxillofacial surgeons, nurses, operating theatre assistants. And we've been there now 5 times in the last 3 years. And we treat people from all over the north of India. Because we provide a free service, free food, free care, and even the relatives, we look after them. My wife comes along, and we've treated over 300 such patients. We are internally grateful, because although this treatment is available in India, these people can't afford it. There's no way they could afford it. So we do it for free.
I mean, one of the things we constantly find is whenever English people go to India to do some charity work, they come back so inspired because people in India are very responsive to support and very thankful and very grateful for it. What was the reaction of your team of doctors and patients?
You're absolutely right. Out of all the people that I facilitate the visits of clinicians from the UK to India. And I'd say 90% of them go back, and some of them have been there 5 or 6 times.
Wow.
And some of them have actually become trustees of the charity in the UK.
Wow.
Because we've registered the Chitrakoot Project charity in the UK now as a charity, and most of the trustees are English people, you know, surgeons, anaesthetists, so on.
Wow.
And it's very inspiring for me and very humbling too in many ways, you know.